Excited to have you. So our focus today, Ro, is going to be more on health and health-related issues that face our community.
Yes.
So yes, I've prepared questions for you regarding that, and also to share with you what are the main challenges that face the various sectors in our community. So let me start with the first one. So Affordable Care Act. I'm sure you were expecting this question. So the Affordable Care Act, popularly we call it Obamacare, and the goal of Affordable Care Act is to provide better health security for our community and to expand coverage to include everybody, to provide access to healthcare for lower income, to guarantee that we have a choice and we hold insurance companies accountable. So that's been the main goal of the Affordable Care Act, to make it affordable. But the Affordable Care Act, or Obamacare, the rates are expected to rise 13% next year, which is 3 times the increase in the last 2 years. So it feels like Obamacare, or affordable care, which is supposed to be affordable, is not really affordable anymore. So what do you think you can do to improve these issues with ACA, and why you think we should join Affordable Care Act?
That's a great question. First, we need a public option, as even President Obama said, because that will put pressure on the insurance companies to lower the premiums and lower the rates. Without the government without people having an option to buy into Medicare, buy into government health care, the insurance companies can continue to increase premiums. So the biggest thing we need is a public option. The second thing we need to do is have some form of tort reform so that we're not having medical malpractice suits that are driving up costs. And we have to have some form of regulation on these insurance companies and on pharmaceuticals. So much of the cost is prescription drugs. So we need far more leverage on getting imported drugs, so where people can re-import drugs which they have at cheaper prices overseas, and that we have leverage doing it. Of course, the Affordable Care Act, the exchange, I would encourage people to sign up if they don't have insurance. It's still better than not having insurance, and it's subsidized, but we have to do a better job in getting the premiums down.
Yeah, absolutely. I think you touched on an important point about the rising cost of prescription drugs. And I know that we will be voting on a proposition related to the prescription drugs. Would you like to educate our community about this prop?
Well, I'm a big supporter of Prop 61, the one you're talking about, which would basically give California the right to buy prescription drugs at a price that's similar to the VA. And the VA gets very good prices. And it would give us collective leverage so that these pharmaceuticals couldn't be jacking up the rates on a given hospital or given patient. And I think that I see it all the time, that these prescription drug prices have gone out of control. So I'm a big supporter of Prop 61. I hope people will vote for it. Of course, the pharmaceutical industry is putting billions of dollars to try to defeat it, but I think voters will see through that.
Absolutely. I think the price of many of the drugs are so high. I work in oncology, and I know that so many of the chemotherapy medications and many of the other medications that are life-saving for our patients are so expensive that even with the insurance coverage, just their premiums, it can bankrupt a lot of people and cause a huge financial